Come in.
Mr. Gonerton?
Yes.
Hey, my name is Laura. I'm going to be your nurse today.
Hello.
It's nice to meet you.
Nice to meet you too.
Okay. Sorry, my hands are wet. I just used hand sanitizer.
Okay.
Why are you here today?
Just here for a checkup.
Okay. Any problems you've had recently?
Mm-mm.
How's your vision doing?
Pretty good.
Have any chest pain, anything like that?
No.
Do you take any medications?
No.
Okay. Have you had your blood pressure checked recently?
Just when I came in.
Okay. And are you fasting today?
Yes.
All right. I'm going to go ahead and take your blood pressure again because it didn't transmit in our system. If you don't mind giving me your left wrist. And then just place your arm over your chest for me. While that's taking the measurement, I'm going to get your temperature. How tall are you, sir?
6'2".
Okay. I'm going to take a pulse. His pulse is regular and strong. While I'm taking a pulse, I would also take a respiratory rate, but I wouldn't tell the patient that I was doing it because it might alter how many respirations they have per minute. Okay, 98 even. Alright. Blood pressure on our monitor is 138 over 87. Does that sound about right?
Yes.
Okay. How much do you typically weigh at home?
About 250 pounds.
Okay, our scale said 251, so that's about right. All I'm going to do today is do a quick assessment of your abdomen because we are limited on time. Normally I'd pull the patient's gown up to look at his skin, hair distribution, see if we had any old surgical scars. But for the purposes of the assignment, we'll go ahead and cover the patient up and leave his gown down. Okay. I'm going to wash the head of my stethoscope, make sure I don't transmit any germs from one patient to another. The door is closed to the room for privacy. And I've adjusted the temperature to make sure it's not too hot or too cold. Alright, if you don't mind, I'm just going to listen to your stomach, okay?
It's fine.
I'm looking for normal active bowel sounds. Listen for about 30 seconds in each quadrant. You want to hear at least 5 to 30 movements. While I'm listening, I'm also looking for the symmetry of his abdomen, kind of feeling with my fingertips to see if there's any keloid scars or anything on the surface of his skin. You actually have quite hyperactive bowel sounds. How often do you have bowel movements?
About twice a day.
Twice a day, and that's normal for you?
Mm-hmm.
Have there been any recent changes in your bowel movements?
No.
Okay. If you don't mind, I'm just going to lay my hands on you and kind of feel. Gentle at first and a little bit harder after that. If I cause you any pain, please tell me right away. I don't want to hurt you.
Okay.
Okay? I'm going to percuss. Right now I'm kind of feeling for air in his abdomen. You want to follow the normal course of the large intestine, which starts over here in your right lower quadrant, ascending, transverse, and descending. So I'm just going to push a little bit harder, okay?
It's fine.
I'm going to slowly work my way up, feeling for any masses or noting any change in the patient's demeanor to see if there's any pain. You might, in some thin patients, be able to feel the liver or spleen. However, that's not the case on this individual. Any pain at all? Okay. I'm going to press down and attempt to feel his aorta. There's just a little bit I can feel just to the left of midline. Can you tell me a little bit about your diet?
I generally eat 2 meals a day,
What 2 meals are those?
lunch and dinner,
So you skip breakfast most days?
most days.
Okay, alright. What kind of foods do you eat?
Typically eat salad or meat.
Okay. Any fried foods?
Gotten away from eating fried foods.
Okay. Are you trying to lose weight?
Trying to lose weight, yeah.
But no unexpected weight loss?
No unexpected weight loss, no.
Okay. Fantastic. Well, everything seems to be good with your abdomen. Since we've got a little bit of extra time, I'm going to go ahead and listen to your heart and lungs if that's okay with you.
That's fine.
Okay. So I'm going to start with the lung assessment. I'm going to listen on the lateral chest first, and then I'll have the patient sit upright, and I'll listen on his back. You take a big deep breath for me. And out. You want to come to the other side and listen in the same location. And in. And out. Are you a smoker, sir?
No.
Okay. There's good air movement on both sides. Just go ahead and sit up for me. You want to avoid any bony prominences when you're auscultating. And take another deep breath. Okay, and out. In. Okay. One more time on this side. And then down low. Big deep breath for me. Okay. Now while you're sitting up, I'm just going to listen here. You don't have to breathe anyway. I'm just listening to your heart. Right now I'm just listening to the patient's apical pulse. He doesn't have a cardiac history. Roughly in the 5th intercostal space, mid-axillary line. And then we're going to jump over here on the right and listen to aortic sounds. I'm going to gently place the bell of my stethoscope over the ankle of his jaw. Right now all I'm hearing is tracheal sound, so just take a deep breath for me and hold it. Okay, you can breathe. I'm going to come over and do the same thing on the right, okay? Take a deep breath and hold it. And relax. So, no carotid breweries. No chest pain, no diminished lung sounds. He's not coarse or rhonchorous. Patient's not a smoker. Did either your mom or your dad have any heart symptoms, heart attacks, things like that?
Not sure about my dad. My mom didn't know.
Okay, alrighty. So you seem like you're trying to lose some weight. You're eating a little bit healthier. Do you exercise?
When I can.
Okay. What kind of things do you do for exercise?
Either walk or hike or get on a machine.
Okay. So it sounds like you have a pretty good plan in place. Do you feel like you'd need to see a dietitian or anything like that?
No.
Do you have any other complaints?
No.
All right. Thank you for coming to see me today.
Thank you.